Tumors of the hematopoietic and lymphoid tissues, Wikipedia audio. Tumors of the hematopoietic and lymphoid tissues or hematopoietic and lymphoid malignancies are tumors that affect the blood, bone marrow, lymph, and lymphatic system. As those elements are all intimately connected through both the circulatory system and the immune system, a disease affecting one will often affect the others as well, making myeloproliferation and lymphoproliferation closely related and often overlapping problems. While uncommon in solid tumors, chromosomal translocations are a common cause of these diseases. This commonly leads to a different approach in diagnosis and treatment of hematological malignancies. Hematological malignancies are malignant neoplasms, and they are generally treated by specialists in hematology and/or oncology. In some centers, hematology/oncology is a single subspecialty of internal medicine, while in others they are considered separate divisions. Not all hematological disorders are malignant. These other blood conditions may also be managed by a hematologist. Diagnosis: hematological malignancies may derive from either of the two major blood cell lineages, myeloid and lymphoid cell lines. The myeloid cell line normally produces granulocytes, erythrocytes, thrombocytes, macrophages, and mast cells. The lymphoid cell line produces B, T, NK, and plasma cells. Lymphomas, lymphocytic leukemias, and myeloma are from the lymphoid line, while acute and chronic myelogenous leukemia, myelodysplastic syndromes, and myeloproliferative diseases are myeloid in origin. A subgroup of them are more severe and are known as hematological malignancies or blood cancer. They may also be referred to as liquid tumors. Adult T-cell leukemia/lymphoma. For the analysis of a suspected hematological malignancy, a complete blood count and blood film are essential, as malignant cells can show in characteristic ways on light microscopy. When there is lymphadenopathy, a biopsy from a lymph node is generally undertaken surgically. In general, a bone marrow biopsy is part of the workup for the analysis of these diseases. All specimens are examined microscopically to determine the nature of the malignancy. A number of these diseases can now be classified by cytogenetics or immunophenotyping of the malignant cells. Historically, hematological malignancies have been most commonly divided by whether the malignancy is mainly located in the blood or in lymph nodes. However, the influential WHO classification placed a greater emphasis on cell lineage. Relative proportions of hematological malignancies in the United States. Treatment can occasionally consist of watchful waiting or symptomatic treatment. The more aggressive forms of disease require treatment with chemotherapy, radiotherapy, immunotherapy, and in some cases a bone marrow transplant. The use of rituximab has been established for the treatment of B-cell-derived hematologic malignancies, including follicular lymphoma and diffuse large B-cell lymphoma. If treatment has been successful, a person is generally followed up at regular intervals to detect recurrence and monitor for secondary malignancy. In the follow-up, which should be done at predetermined regular intervals, general anamnesis is combined with complete blood count and determination of lactate dehydrogenase or thymidine kinase in serum. Taken together, hematological malignancies account for 9.5% of new cancer diagnoses in the United States, and 30,000 patients in the UK are diagnosed each year. Within this category, lymphomas are more common than leukemias. Classification: aggressive, Sézary disease. Treatment: follow-up. Epidemiology.